Why does hair regrow as chemo curls after cancer treatment? When people finish chemotherapy, they often notice their hair growing back in a different way, sometimes curly even if they had straight hair before. This change is quite common and happens because chemotherapy affects the hair follicles, which are responsible for hair growth. Chemotherapy drugs target fast-growing cells, including cancer cells, but they also impact healthy cells like those in hair follicles. These follicles go through different phases: growing, shrinking, and resting. Chemotherapy can cause many hair follicles to enter the resting phase early, leading to hair loss. During treatment, the cells in the hair follicles matrix, especially those that shape the hair shaft, get damaged. This damage can change how the follicle regenerates hair afterward. The shape and texture of hair depend on the structure of the follicle itself, especially parts like the dermal papilla and surrounding cells. When chemotherapy damages these structures, the follicle might temporarily produce hair with a different shape, such as curls or waves. Scientists believe that the reason for curly hair regrowth is related to changes inside the follicle's architecture and how the new hair shaft forms. As the follicle heals and resumes normal function, the hair may gradually return to its original texture. However, this process can take several months or even years. Sometimes, the new hair remains curly or has a different texture permanently if the follicle was significantly damaged. This phenomenon is not limited to any specific cancer type or chemotherapy regimen. It can happen in patients treated for testicular cancer, cervical cancer, or other reproductive cancers because the mechanism of hair loss and regrowth is similar across different treatments. The extent and duration of these changes depend on factors like the type and dose of chemotherapy, genetics, and overall health. It's important to remember that hair regrowth after chemotherapy is usually a sign that recovery is happening. The changes in hair texture are typically temporary, and most people see their hair return to its previous state over time. If someone notices persistent changes or has concerns about hair regrowth, they should speak with a healthcare professional. There might be underlying factors that need attention, and a doctor can provide personalized advice. In summary, hair regrows as curly after cancer treatment because chemotherapy damages the hair follicle's structure, temporarily altering how it produces hair. This results in changes in texture that usually improve as the follicle heals. This experience is common among survivors of testicular, cervical, and other reproductive cancers and is part of the natural healing process. Always consult healthcare providers for guidance tailored to individual recovery journeys.